Navident is a navigation system, and its purpose is to help the implantologist do a better job with less overhead of messing with models and guides and things like that. So we're achieving two main objectives. The first one is producing a better job so that the restoration looks better, the patient suffers less. And the second one is by streamlining the workflow. We're eliminating a lot of the more tedious analog steps in the process, and everything becomes digital. And you don't have to send work to the lab and get the work back from the lab and so on. The whole thing is done on the spot very quickly. The final stage is actually placing the implants where you planned. And that stage, our tracking camera tracks the position of the handpiece and tracks the position of the jaw during the surgery to map the tip of the drill to the CT scan, so that wherever you place the virtual implants will guide you where you're actually going to drill to place the actual implants. Our system has an accuracy of about 0.5 millimeter, which is much higher than what can be achieved without the guidance. And so when the work is done, the implant is placed at the correct location, correct angle, correct height to make the restoration of the final crown much closer to perfection. Another big advantage is that because you don't have to see the bone directly when you drill, we can do the surgery without cutting the gums and lifting them, what's called raising a flap. So you don't cut the gums, then you also don't have to suture the gums, and so there's less swelling, less pain. You don't have sutures hanging in the mouth of the patient. It's much more convenient for the patient. So overall, the system allows the surgery to be done with less chair time, less preparation time, less swelling, less medication the patient has to take, and the result is much better. It requires some training because it requires a change in the way they work. Currently, they have to cut the gums, raise the gums, and then they have to look at the bone very carefully while they drill. In our case, they just look at the screen. The screen guides them to place the tip of the drill at the entry point, and then change the angle to the right angle, and then drill to the depth. So they spend most of the time looking at the screen instead of looking in the mouth, which requires some kind of adaptation, but we find out that it takes usually 1 or 2 patients, and they get used to it, and they just need to verify initially that the system is accurate. If they verify the accuracy verification, it takes just a few seconds. They touch a few teeth, and they see that wherever they touch in the mouth is actually what is shown on the map on the CT. Once they do that, they gain the confidence the system is accurate. They can just look at the screen and drill one hole after the other much faster than otherwise.